The Amplifying Maternal Voices Project is a joint partnership between the Mental Health Foundation and Maternal Mental Health Alliance. We are so pleased that you have made some time today to attend this event, and we hope you find today useful and impactful in your capacity in supporting women, birthing people, and their families. Today is an interactive learning event following on from our National Perinatal Conference last year that I hope many of you were able to attend. We will hear from specialist doctoral researchers. We have a panel discussion with input from the audience, yourselves, and also more excitingly, our partners, Maternal Mental Health Alliance, will be leading and launching our community engagement toolkit. So I will start. Amplifying Maternal Voices, the project, the journey so far. As the Amplifying Maternal Voices project manager from the Mental Health Foundation, this project is very, very dear to me. As a mother of 2 children from Ghanaian heritage, and whom in 2017, I gave birth to a preterm baby at 29 plus 3 weeks, would have dreamed of knowing what I know now over the last 2.5 years that this project has been running. The project title, Amplifying Maternal Voices, is so powerful, and to amplify one's voice can be defined by many studies as to strengthen or to give attention or recognition. And for me, it is extremely important that our project does just that. With that in mind, in October 2021, Maternal Mental Health Foundation secured internal funding, a first of its kind, to deliver a project in line with our COVID response program, which looked specifically at target audiences who was most affected by COVID post-2020. Many of us here today are aware of the specific groups who were and still are impacted by COVID. We set about partnering with Maternal Mental Health Alliance in delivering the Amplifying Maternal Voices project with aims to spotlight the maternal mental health experience of mothers from seldom heard communities. When we say seldom heard, we do not mean hard to reach. We mean women and families who we do not usually hear from. We understand that there are a number of grassroots organizations today who are reaching young parents, Black and ethnic minority global majority groups, mothers seeking sanctuary, and mothers with long-term health conditions. In all of this, in pursuit of accessible healthcare for all women and their families, we have 3 key project activities, one of which we have done to host a national conference, today a learning event to develop and also to develop an engagement toolkit that we have launched later on today, that we will show you later on today in this program. Our aims was to ensure that these specific activities would provide less heard communities to have better access to influencing care and commissioning priorities and informing workforce development, to enable service providers to have a better knowledge and awareness of barriers faced by less heard communities, and use strategies to address these barriers. And third, to amplify the voices and experiences of mothers with diverse cultural backgrounds and experiences, both nationally and locally. In March 2023, we hosted an in-person National Perinatal Mental Conference with the theme of breaking barriers. Many of you who are here today attended and saw how impactful the event was, as we explored a range of factors that can affect women's experience of getting help during pregnancy and after birth, including issues around culture, religion, language, and transport. The sector recognizes the need for tailored, high-quality care that is available to all women. We know that the delays in giving appropriate care can have long-lasting effects on a mother, her child, and the whole family. Today, the Amplifying Maternal Voices Project will launch our community engagement toolkit that will guide local services and grassroots organisations with practical steps on how to amplify seldom heard voices in their service planning, commissioning, and engagement strategies. This toolkit was developed by the Maternal Mental Health Alliance, who tested concepts, designs, and content with their networks across England. Now, without further much ado, I present our first speaker, Patience Oparabe-Pounds and Professor Colin Martin from the University of Suffolk, who will be talking about personalised care and support planning in maternity services.
Thank you, Jessica. Hi, everyone. My name's Patience. I hope you can see and hear me. So myself and Colin, we're not here to present, we're here to discuss. So this is a group activity, so please do be vocal, interactive, etc. I will share my screen and we will introduce ourselves. Apologies whilst I'm presenting if you've got your hand up. Jessica, I hope you'll be able to monitor that, because I think sometimes I'm not able to see.
Sure.
Where am I? Oops. Apologies. Okay. Can you all see my screen? Just shout out.
Yeah.
Great,
Yeah.
Thank you. So just a brief introduction, because I'm very aware that we've got about 20-25 minutes. So my name's Patience. I am an associate midwifery professor at the University of Suffolk and also a consultant midwife at East Suffolk and North Essex NHS Foundation Trust. And you might hear me saying ESNEFT, so that's what ESNEFT stands for. I'm also a chair for the RCM Consultant Midwives Network. And before I hand over to Professor Colin Martin to introduce themselves, I'd just like to say thank you to the team for inviting us to present our work. And thanks to my funders, so that's the East Suffolk North Essex NHS Foundation Trust, for funding my PhD, and for my 3 amazing supervisors. Colin Martin is one of them. They have really guided me through this journey. And today we'll be sharing the work we've been doing on my PhD, which is evaluating better births within ESNEFT. And we're focusing on midwifery continuity of care model and personalised care and support planning in maternity services. Over to you, Professor Colin, to introduce yourself.
Lovely, thank you, Patience. And again, Patience, which is a colleague and also my PhD student, and completely marvellous. My name's Professor Colin Martin, and I'm Professor at the University of Suffolk and Clinical Director of the Institute of Health and Wellbeing. I also have a joint appointment at ESNEFT as well, so a focus of my research is very much around clinical, and my specialist area is perinatal wellbeing. And so a focus of that work is around birth experience and improving birth experience both locally, nationally and internationally. Hence the reason I'm in Australia for the next couple of days is actually setting up a project on birth experience and improving birth outcomes over here. Patience.
Thank you so much, Professor Colin, and thank you so much for joining in. He's in Australia, if you didn't hear that, and yeah, he's amazing like that. Thank you, Colin. So today's discussion will be around the power of personalised care. Can we all get our phones out? Because I'd like you to take a picture of this riddle, and I'll stop sharing my screen so we can discuss it briefly. I'll give you about 5 seconds, if that's okay, to just take a screenshot or take a picture, or if you're very good at remembering, just quickly read it. And we're just going to try to to solve this riddle. Okay, I'm going to stop sharing. Oops. Oh. Sorry, Jessica, I'm having problems. Okay, let me just keep it on. I really wanted to see people's faces because I can't see anything at all. And I'm unable to stop sharing. So can I have somebody, anybody, just shout out, because I really can't see you. Shout out. What did Lois say? Added you to. Shout out how this can be. So a father and his son are involved in a horrific car crash, and the man died at the scene. The son survives and is rushed to hospital. But when he arrives into the operating theatre, the surgeon pulls away and says, "I can't operate on this boy. He's my son." How can this be? I'm just going to give us a few seconds to think about this, and then please just shout out. If you're ready to shout, just do. Unfortunately,
James's mother.
Mother.
Okay. Anyone else?
Mother or two dads.
Or two dads? Yes.
Yeah.
Like that.
I was about to say two dads. Yeah.
Great. So we've got mother. We've got two dads. Anyone else?
The son who survives the crash is actually the surgeon, and it's just another patient he's operating on.
Yep, I like that too. I like that very much.
There's an adopted son.
Yep, could be. Okay, so I let it out. Thank you all so
Could
much.
be
And
the
this is really
grandson.
the grandson. Yep, that's really good. Anyone else? Shout out. So we've got
Could
mother,
just
two
remind him
dads.
of his son.
Remind him of his son. Yep, could be.
And like morally and stuff like that. Yeah.
We've got stepson, we've got grandson, we've got remind him of his son. And all of this is amazing because, sorry, go on.
Trans could be.
Trans.
Yeah.
Yeah, could be that as well. Can I just say that you're all right and you're all correct, but the answer to this is that it's his mother. And I'm really pleased that you got it first time round, because it really shows how inclusive you are and how you're thinking outside of the box and bias free. And yeah, I mean, I love the responses. I've never had these responses before, so that's really great. It just shows how diverse this group is. And the reason why I thought we should kind of have a brain teaser is because it's very easy for us to use our biasness in healthcare. We have a patient or a birthing person in front of us, and all we see is that person. We sometimes, for many reasons, are unable to think outside of what that person could be bringing with them. For example, their mental well-being or mental health, their emotional health, their physical, as well as their social background as well. So this is what this riddle is really about. It's about us being bias-free and about us being inclusive. So midwifery continuity of care model and personalized care, which I'll give a brief intro of, is designed to encourage professionals to focus on what matters to women and birthing people, taking their physical, mental well-being and social needs into consideration when planning their care, and it promotes bias-free and inclusive maternity care. So today's focus will be focusing on personalised maternity care. And I'll just read something from some policy documents just to sort of give you a bit of context. So following the maternity review and the publication of Better Births in 2016, one of the key findings was that personalised care centred on the woman, her baby, her family was central to ensuring that women received the best care possible. More recently, last year in March, the 3-year delivery plan for maternity and neonatal services was published, and lots of you might already know about this document. And this policy document highlights the need for maternity and neonatal services to be safer, more personalised and more equitable. So every person should have a personalised care plan with their midwife and or other relevant professionals that clearly sets out their preferences and decisions about their maternity care. This should be kept up to date throughout their maternity journey and remain relevant to their wider health needs. So personalised care is highlighted as being particularly beneficial to people from lower socioeconomic groups and presented as a positive step towards reducing health inequalities by tackling the implementation of personalised care and support plans according to age, ethnicity, and complex social factors. And just to round it up, this is highly topical in light of public pressure for the NHS to tackle inequalities in maternity mortality, and charities like Mental Health Foundation, why we're here today, has called for the improvement of services and experiences for historically underserved communities at risk of poorer outcomes.
Hi, patient. Sorry, your screen is not being shared.
Oh, hold on. I'm just going to have to come out. Apologies. I think it's when I try to unshare and let's try and share again. It's on this one. Okay, can you see now?
Yes.
Lovely, thank you. So this is the slide I had up when I was reading. And if you can see, these are comments that we hear all the time. It's not new to us. It's just basically highlighting why personalised care is important and how it can tackle some of these issues. So just a brief overview of my research, my PhD. So we all know that women's health and maternity services are high on the national safety in healthcare agenda, which drives maternity services to focus on consistently putting actions in place which ensure that women and their families are listened to at every stage of their health and well-being journey. Some of these actions is the introduction of MCOC, which is midwifery continuity of carer, and PCSP, personalised care and support plan in maternity services. Now, my PhD is very much focused and driven by global drivers like the Sustainable Developmental Goals, and by national drivers, which is outlined below. I'm not going to go through that because we're quite familiar with some of these policy documents and safety reports. And also SNFs, the trust that's I'm funded by, they also have a value to treat everyone as an individual and also to tackle health inequalities. So my project looks at 2 work streams. So I've put it in work stream 1 and work stream 2. So midwifery continuity of carer is work stream 1. And looking at where we were with MCOC, that kind of builds on my rationale for doing my study, really. So a very, very long time ago, back in 1999, continuity of care model was seen as the ideal or default model of care. And in 2021, this was very, very much driven, and we were, geared up and ready to make it a default model of care with lots and lots of evidence and studies that highlights that it's a great model of care for women and birthing people, and also gives midwives the flexibility to provide the midwifery care that they really want to. And then where we are now. So however, the implementation strategy was changed to address challenges and concerns. There were several stakeholders that highlighted the need to ensure that the transition of MCOC does not put undue pressure on midwives and compromise safe staffing levels. And some of you might be aware that this was further reinforced by the Ockenden final report in 2022. So you will find that some of the MCOC projects within hospitals have been paused. There are some running, but very, very small amounts, or on very, very small scale. And some trust units are not doing it at all. So the aim of my study for this work stream is to develop a better understanding of obstetricians and midwives' views of the introduction of MCOC in maternity services across ESNEFT, and to share recommendations for how to safely implement and sustain the rollout of the model of care. The second work stream is on personalised care and support planning. So personalised care and support planning is a document which is owned by women and birthing people, and ideally should be with them and should be reviewed at every contact. And this should look and consider their family situation, health and well-being and preferences, so that their care reflects their needs and their wishes. So the study aims to provide an opportunity to better understand the barriers and facilitators of implementing PCSP in maternity services across ESNEFT, and can inform best practice in developing PCSP more widely in other hospital trusts, regionally and potentially nationally. I'm not really going to go through this slide very much. It was just to give you an idea of where personalised care comes from, and that it's not just a maternity mandate, it is an NHS initiative for the whole of NHS. And we've got 6 components of personalised care. So there's shared decision making and patient choice. So in maternity, it's really important for us to listen and respect women's wishes, involving them in their care plan. Personalised care and support planning, which is what my study looks at, is focused on what matters to women and birthing people, bias-free, like we said before, and inclusive. And then we've got NHS at home, some support people through the use of technology, to better self-manage their care at home. And there's social prescribing and community-based support. And this is all about peer support and using community sectors and agencies in the community to support women and birthing people. And then there's support self-management, it's empowering women once again through peer support and parent education. And then there's personalised health budgets and integrated personal budgets. So I like telling stories. If you know me, I'm I just love telling stories. So just to give you a bit of an example, or let's say scenario of my journey as a midwife and PCS and using personalised care and support plans before it was known as personalised care and support planning. So in 2017, I was a perinatal mental health specialist midwife, and I looked after women and birthing people with moderate to severe mental health disorders. So that included bipolar, schizophrenia, severe anxiety, depression, and emotionally and unstable personality disorder. Now, for me, it was an opportunity to really get to know the women, get to know what their triggers were, what their fears were with regards to birthing, getting to know their support network, what they wish to have in labour for the birth and postnatal period. And we were very lucky in that team because we did have a care plan, and we had MDT meetings for so multidisciplinary team meetings or multi-agency team meetings. Sometimes it will involve, it definitely involved the mental health team, as well as the midwifery mental health team. So we had psychologists and psychiatrists involved. We had mental health nurses involved. Sometimes we had social services involved, and other agencies involved as well. And we used to really come up with some clear plans of how to provide the best care for these women. And for me, that was brilliant because I couldn't see that happening elsewhere. So you can see here, as a midwife, we don't just deliver babies, you know, we very much champion safe, equitable and personalised care. The woman's pain is our pain and their wish is our command. So there's this lady I looked after, and what we did was I used to see them in the clinic. When I say we, there were two of us specialist midwives, and what we used to have was, Jessica, let me know if I'm running out of time, please. Yeah, because I can't see anything at all.
We've got about
So
5 minutes.
5 minutes.
Yeah.
Okay, thank you. So we used to see women in the antenatal period. They used to come to our clinics, and intrapartum care, so the birth was not always we weren't always able to facilitate the birth, but in the postnatal period we used to see them on the wards as well. But I was very privileged to see this woman antenatally, the birth and the postnatal period. And I remember when I went into her room after she had had a baby, I introduced myself, and you know, it was fine. We knew her triggers because she told us her triggers. We had a list of her medications. She told us, you know, her mum and her partner were aware of her triggers, and that she was happy to be admitted to mum and baby unit if she deteriorated. So I went to see her, you know, said hello and congratulations. She was fine. That was right at the beginning of the shift. This was a night shift, by the way, in the middle of the night, helping her with the feeding, you know, and I could see this woman declining. I could see her deteriorating because I knew her triggers, and I knew her mood. So the things that she was saying, you know, she didn't recognize that I had been there right from the beginning of the shift. That's one example. And, you know, as time went on, she became more afraid. She didn't even believe or even know that she had a baby yet, which, you know, was a total change in her situation. And she felt that somebody was going to take her baby. And as a midwife, that was the first time I remember feeling a woman's pain. I cried because I knew the woman and I could see her deteriorating. And for me, is when she curled up in the corner and she went quiet, and we just knew. The husband started crying, and I looked at him and said to him, "It's okay, we have a plan. Should I proceed?" And he said yes. And for me, having that plan in place made that care seamless. Although, yes, we would have preferred she had gone home with her baby and well. However, the reason why it was seamless and probably better than if there was no plan in place is because we knew exactly what to do. The woman herself had agreed to this plan prior. The partner was aware, the mum was aware, and the staff were also aware. So to conclude, introduction of PCSP in maternity service is really important, and every effort should be made by all professionals involved in the maternity care to make clear, personalised care and support plans. And I will end here so that Professor Colin Martin can chip in with some of the research ideas that he's come across.
Great, thank you, Patience. I don't think I've got a very good internet connection here, so if it keeps coming in and out, I apologise, but I'll be brief. I mean, most of the work that we're focused on, certainly in Trust and at the university, in terms of improving health outcomes, in terms of perinatal, is very much focused around developing the evidence base. And certainly a focus of the work we're doing is looking at birth experience. And one of the most important things about the focus of that is that we can measure it, and we can measure it very reliably, and we can measure it also cross-culturally with a questionnaire that I developed a few years ago.
Colin, are you still there?
But I'm still here. I'm sorry about that. But so we developed a questionnaire that really assesses birth experience. And I think the important take-home point about it is it predicts lots of quite diverse perinatal outcomes, which are important to us as both clinicians and researchers. So again, and that particular aspect of work is embedded into patients' use PhD as well.
Thank you. I think that's the end of our presentation, everyone. Thank you so much. And if you've got any questions, please do put it in the chat bar.
Thank you so much, Patience and Professor Colin. We really, really appreciate the work that you're doing. I don't know about anyone else, but I found Patience's example extremely moving and really shows the importance of building relationships and having that personalised care plan in place. So we really, really, really appreciate those words. If there are questions, please put it in the chat. As Patience said, she's around to answer some kind of specific questions while we move on and keep to time. So next, I will now invite Jennifer Ogunyemi from Sisters in Business, Jade Edwards, a project manager here at the Mental Health Foundation, Young Mums Connect, and Anissa Key-Scott from MumBub Hub to come forward to have a little bit of a discussion around specific target groups. All three women were influential in the Amplifying Maternal Voices conference last year and will provide insight into best practice and next steps. So if you guys would, I will spotlight us so that we can have a nice conversation, if you don't mind muting yourselves. Unmuting yourselves, should I say. And Anissa. Welcome, ladies. Thank you so much for being here. We have a few questions and then we will open it up to the audience. So I will just ask you all just to introduce yourself briefly, your organisation and the women and families that you work with or support. I will hand over to Jennifer.
Good morning. Thank you so much for having me, Jessica. My name is Jennifer Ogunyemi and I am the founder of Sisters in Business. My years of work has spanned in maternity from midwifery to breastfeeding consultancy, all the way down to now advocating for Muslim women and their birthing experiences, as well as mental health, the whole perinatal sphere of things as well. Also a mother of four, so understanding from that lived experience perspective. And that's a bit about me. Thank you.
Jade.
Hi everyone, my name is Jade. I'm actually a project manager at the Mental Health Foundation for Young Mums Connect, which is a 3-year peer support project that uses a creative and whole family approach within community settings. And one of the taglines that I use quite often is normalising mental health conversations and creating safe spaces for young mothers who are under the age of 25. You might see a lot of passion come out when I'm answering the questions. I was actually or became a mum at the age of 15 and I struggled a lot with my mental health and was quite fearful to speak to anybody about it. So these groups are really, really important, not just for the mothers, but for their children as well. So that's a little bit about me.
And Anissa, please.
Thank you, Jessica. Good morning, everyone. I'm Anissa Key-Scott. I'm a mother of 3. I'm also the co-founder of a community interest group called MumBub Hub, where we really focus on supporting women through pregnancy and the postpartum phase, especially during those early days immediately after birth, and making sure that women have the resources and the tools to be able to either advocate for themselves or to inform themselves during that period.
Thank you. So now we know a little bit more about you. Can you please share, so this question is for all 3 ladies, can you share, if any, with us 2 key highlights in the last 2.5 years that you have seen that have helped to overcome barriers to accessing perinatal mental health for the groups you work with? Jennifer, you can go first.
So I think for me, the first key area is advocation, and how to self-advocate for oneself has been really important in the work that I've been doing for the past 2.5 years. As we know, there is so much work that is going on, you know, with so many reports that have come out, with so many groups that we have, which are doing amazing things, but still with the group of women that I work with, there's still a level of advocation that's not been met yet. So, you know, people don't really know how to advocate for the Muslim women, or they don't know what to say, or, you know, what are some of the culturally sensitive things that they shouldn't be saying. And so we focused we shifted our focus on actually how can we develop the woman herself? How can we equip her with the things that she knows, in which she can have certain conversations and that she feels empowered in those conversations? So self-advocation is something that we've been doing. The second thing that we've been doing is amplifying the voices of maternity leaders who are Muslim women, because there is a lot of midwives who are Muslim women. There are a lot of women who own community interest companies who are also Muslim women. How have we been able to give them the light, the spotlight, to come forward, to amplify, to advocate for the women that they work and they support with? So what we've been doing is we've been amplifying them. We've been, you know, making sure that they are in key conversations, that they are sitting on boards, that they are really ingrained where they usually aren't invited, just so that our voices can become stronger and our voices can become a lot more unified, rather than everyone saying the same thing at different times. We needed that one voice. So those are the two key things we've been working on.
Thank you. Amazing. I really love that self-advocation and, you know, creating spaces for those maternity leaders, Muslim maternity leaders. Jade, would you like to share next? Same question.
Yeah, sure. So there's a couple of things that we've been doing, and I think most importantly is just running a group just for young mums and giving them that space. And like I mentioned with our mini tagline, it's not about their parenting, it's not about their social worker asking them questions, it's not about what their parents think or not think. It's independent of any professional or anything that's going on sort of outside of the group. It's just a space for them to come with their friends or by themselves, even sometimes without their baby as well, taking away that stigmatizing sort of connotations around what a young mum means or what that looks like. So I think that safe space was really important to us. But a second one, and I think when we look at stats and we look at some of the barriers, it's often said that young parents don't want to engage with services or they don't want to attend groups. I think we really looked into those barriers. So things like transportation, things like ordering cabs. So if you work in the office with me, or sometimes I'm at home, I'm constantly trying to sort out like travel cars and Ubers, because I understand that once you get them into the place, into that group, and they have that confidence, they will most definitely take their buggy and they will come. And I think that's what we definitely saw. But another thing is understanding that sometimes going to a group for the first time for anybody, like even as adults, your first time at work is like so challenging. That anxiety that comes with that. So meeting them outside of the group, outside of that location, whether that be at a park or having a picnic, before they even enter into the group was really, really significant for us within the project, but also the facilitators as well. So I think those are probably the main two. But the third one, which was most important, is that giving them that confidence beyond the group. I think my biggest fear, especially working within the charity sector, is that you have a 2-year pot of funding and it's almost like, what next? You're kind of fighting for more funding. But within our project, I really wanted to make sure that young mothers feel equipped enough to access support, but they feel more confident within themselves, whether that's education attainment, whether that's finding new employment, but that peer facilitation. So it's not just about them receiving peer support, but them feeling like they can also give that peer support beyond the project as well. So those are probably the 3 main factors, I would say.
Thank you, Jade. That's extremely powerful. I think creating that safe space is key. I think there's a number of research around the importance of peer support, and going further than that and providing that safe space and the means to get there is really, really powerful. So thank you for sharing. Anissa, from your experience with Mum Bub Hub.
Sure. So I would go a bit further back than 2.5 years, but during COVID, we had set up a community, or we received a community grant to be able to deliver virtual support for women, particularly in isolated areas. You know, nationally, there are a lot of women who aren't receiving the support that they actually require. And so we tailored that support so that they're able to have virtual sessions, either with a postpartum therapist or with a doula to support them with their nutrition or birth plan. And we really tried to make sure that we had, helped women that not only had previous mental health issues, but also that were new mothers who had no experience before and therefore quite at risk of isolation. And we know, that 30 out of 1,000 women experience severe depression, and 100 to 150 out of 1,000 experience mild to moderate depression. So from our perspective, it's really about finding that window of opportunity, particularly during pregnancy or postpartum, where you can really tap in and to be able to tailor and find the support for those women. So that was one of the first aspects. And I would say, secondly, in most recent times, the conversations about postpartum care, birth trauma, I think it's really developing in the space. Of course, there's more to do. So we really try to generate those conversations, even if it's just, a group of mothers sharing their experience through casual, candid conversation. It's amazing how therapeutic that can be for some women, but also where there are triggering aspects, how we can signpost them to the correct resources.
Thank you. Again, from your perspective as a CIC, a grassroots organisation, the important work that you guys are doing, as we know the NHS is stretched, so sharing with us those key highlights are really, really impactful for us to understand and learn. The second question is, can you share with us what you think is the most important way that we can amplify the voices of those we do usually hear from?
Should I start with that?
Yeah, sure.
I think for me, it's really simple. It's about giving people the platform, giving people the funding, giving them the capacity, helping them grow in the way that they're going to be able to support their community. And, this is a long-standing conversation that we've had with NHS in that, we want to see more collaborations between grassroots organisations and the NHS. We want to see more collaborations with grassroots organisations and the bigger organisations that are already out and doing the work. And the reason why that is because we understand that the smaller grassroots organisations have the trust, the transparency, they have the standing in the community to be able to do the work that they do. I've had this conversation, very similar conversation with corporates within Canary Wharf. The question is that why is it that grassroots organizations always have to feel like Olivers with begging bowls? Why do we constantly feel like this? And it's because we're constantly having to prove ourselves in a way that other organizations probably don't have to prove themselves. And now I want to shift more to ethnic minority organizations, because there are many disparities that they are up against when we are talking about funding, when we are talking about supporting communities. It's really about thinking about how can we increase capacity? Is that through funding? Is that through training? Is that through support? What is it that we can do to make sure that this community leader is being supported, which in return means that their community will also be supported as well?
Oh, you're on mute, Jess.
Apologies, sorry. The same question to Jade, thank you.
Yeah, I think in order to continue the great work, I guess across the board, and I can speak specifically about young mums, is I think 3 things. I think number 1 is removing assumptions, especially having a new baby for anyone. The reactions are totally going to be different. And those stigmatizing sort of like comments and connotations that we associate with young parents is really important to continue that work, to just remove that for a second. I think the second one is listen. I think we talk about active listening all the time. We do lots of training on it, but listening to the needs of your young parents or the mothers that you're supporting and finding out what it is that they need and what are some of the things that they need support in. We often assume, let me signpost you here or let me signpost you there, without actually hearing out what kind of support they want. I think the last thing, which I really try to do within the Mental Health Foundation, and sometimes I might get a little bit of trouble for it, be futuristic and innovative in the care that you're giving. It's very, you know, simple to kind of do a project and you do it like this and you give this type of care, but really think about, is it journals, or is it a trip down to the pond, for example, whatever it may be, to best support sort of like your patients or your mothers or even their children, thinking about those things, because you'll be surprised how receptive your mothers would be to the type of care that you're giving. So I think those 3 things would be vitally important.
Thank you, Jade. And yeah, I think being creative and innovative is really, really important. Very, very insightful. Same to you, Anissa?
I would say, from my own personal experience and also from speaking to other mothers, it's really about equipping with women with the information, the tools and the resources to be able to optimize the time that they do have with their care providers, so that they can have, you know, very specific questions about their own health or, you know, their own concerns or worries, but also about sort of inspiring that confidence within women to either advocate for themselves or to have someone with them that can speak on their behalf. And so for us, it's really about amplifying their own personal care plan. So, you know, coming with questions that are very specific and targeted. And then, of course, it's a two-way dialogue. I'm very aware, you know, caseloads are extremely pressed. And so it's about using that time most efficiently and listening to what women are saying. You know, if it's a community midwife appointment or their antenatal appointment, what are they saying outside, you know, reading between the lines, and trying to offer tailored support for that as well.
Thank you. I think that also does echo the work that Patience and Professor Colin Martin are doing around personalised care and kind of, having that confidence and advocation. So thank you. Third question before we open up to the audience is, finally, what do you think the next step should be to continue the work to reduce barriers and improve access to support for the groups of people you work with? Jennifer,
For me, it's, you know, giving us a chance to sit at the table, you know, allowing us to lead with our own expertise, allowing us to be able to say, well, we think this is right and we think this is wrong, you know, giving us more of a chance higher up, you know, in leadership, for instance. You know, yes, we're grassroots organizations, but we don't want to forever be grassroots organizations. We want to become national organizations just as anybody else is with the work that we do. The second thing is that, you know, it's conferences like this or seminars like this that really makes me think that there's so much more unity in what we do, but it doesn't go further than this. So what do we need? We need people who have the power, or people who are able to open the doors, that we're able to unify on a larger level, on a larger scale, where we're all able to come together in the different ways that we work with the expertise that we have, and in how we can continue to drive forward, like a strategy, a larger strategy for us to be able to drive forward for the next 2-3 years, and not have to worry about, like what Jade said, you know, where is the next pot of funding coming? You know, so these are the 2 things that I think we would really drive forward.
thank you. Same to you, Jade.
Likewise, I know I've spoken to Maria. I can't see her, but I know she's here somewhere. But I think, talking about sort of personally to myself and the project, we need a national campaign on stigma, like re-destigmatizing sort of connotations and the barriers that we think are often faced by young mothers, and giving them the opportunity to change the narrative about the care that they want and the care that they feel like they should and deserve to receive. But I think another one, which is most importantly to me, is that empowerment, that when you are struggling with your mental health and you feel like you're in a place where you don't have a sense of purpose, the last thing you want to do is sit down with your GP and they ask, how are you feeling? Let's tick this box. But thinking about those futuristic plans, is it education, is it employment, which I mentioned before, and giving them that platform to feel like they can achieve and they can do better. But also, just because you're struggling with your mental health doesn't mean that's going to be a permanent state forever. And I think the last one, which I think, Jennifer, you've touched on, that peer support, but also equipping them to give them the opportunity to feel like they can lead their own groups. I think that sense of purpose is vitally important, especially for lots of young mothers. Nobody really wants to be in a place where they're constantly asking for help. And that doesn't mean that help is not needed and is not important. It definitely is. But giving them the tools to feel like they can help others and they can be a part of your organizations as well, whether that's your CEO or whether that's your peer facilitator, whatever role that may be, just giving them the opportunity to do that, I think would be important.
Thank you, Jade. I love that. I think it's the element of peer alumni, kind of like following on from peer support and kind of taking that and building that resilience and to kind of go forth and stand up and advocate for yourself. So I really, really do enjoy that. Anissa, same to you.
I would say that, there's really an opportunity to pull some of the resources that we do have. There are several grassroots organisations with their own individual specialities who are doing the work on the ground. Like Jennifer said, they've already built that trust, that confidence. And so it's really about pooling that resource and making the use of those shared specialisms. The question is, and the gap we know is, how do we make sure we can scale that, or that those are available on a wider geographical span? So, as we're growing wider in the nation, there are some gaps there. And, we really need to think about how we can bring that together from the top and to the bottom as well. And so I would say, like you say, and echoing both Jade and Jennifer, it's about bringing people to the table, thinking of opportunities when actually this person could be valuable or their voice would be relevant here. We've got maternity groups in local boroughs, bringing those women to the table, or those groups, so that they have a voice.
Amazing. And I think what's really powerful is no matter the women that you guys support, it's kind of like the same themes going through. So it's really trying to amplify the voices, regardless if you're a Black Muslim woman, a young mum, or supporting women with postpartum. I think it echoes that kind of transparency across the board in just providing a space and all of these themes that have come out. We have got 10 minutes to open up to the audience. If you have a specific question, if you want to write it in the chat or unmute yourselves to ask any of these three amazing ladies any specific questions, please do. We want to kind of be interactive, give you the opportunity to kind of deeper. Okay, I think we have Catherine Beard. You can unmute yourself.
Hiya, my name's Kath. I'm based in Birmingham. I'm the lived experience and peer support lead for our perinatal community mental health services. And one thing that I'm trying to do at the moment is hold services to account. We've had very similar things. We've had lots of reports, lots of people make very sad faces and say this is terrible, something's got to be done, and then it falls off the agenda. And we've found that the local grassroots organisations, we're currently working at the moment to be held to account by them. We've trying to shift the power back. And I just wondered if there's any advice from you, you guys, in any positive ways that you've seen, especially working with an NHS organisation. And I'm absolutely open. I'm the first person to point out the flaws. It's and there's many of them, because I absolutely, everything you've said, it's bang on the money of what we need to do. So I just wondered if you've got any advice for how to strengthen that sense of accountability. I love the idea of leadership, actually. I think that needs to sit outside of the NHS and we are answerable to it. But I just wondered if you had any more advice from your experiences.
Does anyone want to take that specifically?
What I would say is I spent the last 3-4 years working with local MVP chairs in North East London, in 3 hospitals, Whipps Cross, Royal London and Newham. And there were some things that, as you know, with commissioners and stakeholders, there are very specific things that they want to see, and they will keep regurgitating the same thing over and over and over again. But one thing that I became very unpopular for was constantly driving back to what the impact should be. Now I get it. KPIs are really important. We have to understand where things are going and how, and you know, where money is going to the NHS that we're talking about. But actually, it doesn't trump the lives of the women that we're trying to impact and change. And I became very unpopular. So whenever I spoke, you get the eye rolls and you get, you know, the whole, oh, here we go again. But actually, I got comfortable with that because it meant that I kept bringing to the table, I kept bringing back to the forefront that it's not about anything else apart from the women that we're talking to, that we're trying to support and we're talking to. The second thing that I would say is, again, it's unpopular opinion, but we do not need any more consultants to come on to tell me how women are feeling about certain things anymore. It's enough. We don't need any more research papers. We don't need any more research bids being put in. What we need is money for the work to be done. And it's as clear as that. And I understand that politically and, you know, structurally, there's so many things to fight against, but you just have to get comfortable with being the person that no one really wants to hear from anymore. You know, when they see your email drop into their inbox, they're like, oh my gosh, what does she want? But they know they have to answer you because they know that you won't let rest. You know, so it is about becoming, getting comfortable with the uncomfortable idea that people don't like you for the work that you do, but then also not taking it personally as well, would be my advice.
I think
Thank you so much. Go on.
just to echo that, I think one of the things that I've loved the Mental Health Foundation for, especially within our programs team, is those that have the lived experience know exactly what the needs are for those that they support. So if you've got a project or you've got a program, or even within the NHS, and there's certain changes that need to be made, advocate for getting those who know what is going on. I think is important. I know I'm going to reference Miriam all the time. That lived experience leadership of those that have experienced certain things and know how to use their professional development and their lived experience to actually create change, and working in partnerships with the NHS Trust and various organisations is the best way forward. I think that partnership is extremely important. No one wants to be told how to support their mothers, but we also want to support you because you do have the structures in place, but it has to be an equal pair.
Thank you so much. Amazing question, Kath. Thank you. I think we had a hand up. Was it Amanda?
Good morning, everybody. Lovely to see the panel today. Good morning, panel. Thank you for your answers. I do have a question, but I just also wanted to say thank you for what you just said before, because I'm in Birmingham and I know Kath as well in the work that she's trying to do. And we're a little bit slow, you know, as the Londoners would say, we're a country. When I look at London, I see the things that you're doing and I'm always amazed at how the system seems to want to work with you, because yeah, we have to have the eye roll and we have to be the ones that annoy people. But sometimes that's hard work and it's not healthy. It can take its toll on you mentally, physically, emotionally, and so sometimes we step away. And sometimes I wonder if that's what the system likes. They want you to step away because then they don't have to deal with you. But we also, as Jennifer said, have to get comfortable with it, but we have to find the resources to keep ourselves safe. We're trying to keep women safe, but what about us? You know, it can really drive you down. So that's all I wanted to say on that point. But the question I had was, you were talking earlier on about advocating for ourselves and the women advocating for themselves. And there's a conversation that we've had in the past about what we call agency, which is that really strange word, isn't it? You know, what does that mean and who has it and how, you know, it's power and all that. But one of the things that I've kind of come across quite a few times when I'm talking to women is that when Black women express agency in these spaces, it's seen as, it's quite dangerous for us, because it's seen as us being aggressive and us, you know, we're being extra and all those things. And I just wanted to kind of ask, how can we manage to encourage women to have agency and advocate for themselves, but how do we keep them safe enough to do that and feel that they can speak up for themselves without being dealt with in a really negative way in that space? Because it can be a very dangerous space when you're on your own in the maternity ward, you haven't got anyone with you and you're advocating for yourself, can be quite dangerous as well. So how do we balance that? Thank you, ladies.
I don't mind answering. I think, you know, a lot of people think you can go through pregnancy, the antenatal period, and just be very relaxed about it. But for many, it's quite an anxiety-ridden time. And so I think there's so much preparation to be had during those times, even prior to appointments, meetings with consultants, if you've got specialist care, for example. And, you know, there's no reason why women can't come with a list of questions. I'm not saying, you know, essay, but if you have a list of 3 questions that you really want to have answered during that protected time, then there's no reason why that shouldn't happen. I have done that for myself with my own care during antenatal period. I've also been on the receiving end of, you know, someone not listening to anything I'm saying, and I'm being very adamant that this is the care that I advocate for myself. And a lot of the time it is about being steadfast and really having that self-belief. So I think it does boil down to having that confidence as well. So how can we make women feel more empowered, more confident, and the ability to trust themselves? I think that is the essence of it, really.
I definitely
Thank
agree.
you.
And I think my added thing to that would be, you know, like I said, it's very unpopular opinion, the things that I say, but you know, just as we have maternity assistants on wards and, you know, maternity healthcare assistants, why can't we have advocacy specialists in antenatal wards, in postnatal wards? You know, someone that's assigned to women who want to advocate for themselves, but need that additional support. Maybe it's 5 minutes before she goes into her appointment that, you know, someone goes over the questions with her. Maybe it's someone sitting in the appointment with her. The second part to that is accountability. Now, the NHS is very, very good. Any organization is very, very good at supporting each other, regardless of whether they're right or they're wrong. And I think this is where we go wrong as organizations, that sometimes we don't like to admit where our faults are, and we have to get comfortable with admitting that we are wrong for certain things. The more you hold people to account is the more people will be able to be apologetic and rethink the way that they do things. I sit in significant incident meetings all the time. One thing that really bothered me about these meetings is that I'm hearing about, you know, the learning that could be learned from this, or, you know, what is it that we're taking away? But how do you know what you're taking away is going to be specific if I do not know the color of the woman's skin, her religion, or any other cultural connotation that I need to be able to take learning away from that? Right? So there are certain things that we need to put in place that will help us keep each other accountable. But it also means that if I'm also empowered enough to hold someone who's in higher level than me accountable, then it means that we're doing something right somewhere. So it's a two-pronged approach. Let's start employing advocating specialists or advocation specialists into place in the hospitals. And secondly, start holding people to account, because we need to.
Thank you so much. That was so powerful. I love that. I think we are due a comfort break right on time. We will be back at 11:20. Because of the recording, I will not stop it. We can just go on mute and come off our screen to share with you our next segment with our partners at Maternal Mental Health Alliance. Sian Drinkwater will be taking the podium next to launching of the engagement toolkit. So I'll hand over to Sian.
Thank you so much, Jess. I'm just so excited to be here, and it's just so great sharing this space with so many incredible people. So I feel really honoured to be doing that. So as Jess said, I'm Sian. I'm Community Engagement Lead at the Maternal Mental Health Alliance. And we'll be sharing the AMV toolkit with you. But just before we do that, we thought it would be good to share a film which is featuring some of the Maternal Mental Health Alliance lived experience champions. And this really as a kind of reminder of why perinatal mental health support and change is so important and so needed. So just to note very quickly that these films obviously will show our champions sharing their stories of perinatal mental health challenges. And we know that sometimes that can be difficult to listen to. So depending on what's going on in your world today, please do check in with yourself when you're watching, and do whatever it is you need to look after yourself. But with that in mind, I will hand over to Amy, who's going to share the video for us.
I think because everyone's sort of so geared up when you sort of have a baby, don't they? Sort of, oh, it's amazing, you know, I bet you're loving it. And because of that, sort of, there's no openings in conversations for you to say, actually, no, I'm not finding it enjoyable. I'm sort of really struggling with it.
I didn't know it was normal to feel like this. There was no one like me prior saying this is what you will feel.
One morning I woke up and didn't recognise my son. That was the day that the home treatment team had to come out and assess that I needed to go into hospital.
I was really happy to have two healthy, gorgeous little boys, but it still didn't change the fact that I had a severe mental illness.
After I had the birth of my first child, my son, something didn't feel right. I didn't have that instant bond.
I was getting really anxious, irritable, I had suicidal thoughts.
It's got to a stage where I was sort of going to bed thinking, I don't want to wake up tomorrow, and then waking up in the morning thinking, I don't want to have to live through another day. That was what shocked me, I suppose, into thinking I need to get help because I can't just stay like this forever. I can't.
Back then they didn't have like specialist perinatal mental health services locally. I went to my GP, I got prescribed antidepressant medication.
The doctor could see in my eyes that something wasn't right, and then the doctor sort of signposted me to some groups. But she saw it, she recognised, she saw something in me. I'll never forget that. I would say for someone who is struggling, find your person you feel comfortable with to share.
I wanted to go up onto rooftops and scream, I know what's wrong with me. I have clarity now.
Once you've got that support and you've accessed it, you're halfway there.
It's okay to not be okay. Getting the right support at the right time makes such a difference to your experience.
Well, firstly, just want to say a huge thank you, obviously, to our champions for sharing those stories. And our lived experience champions really have been part of the Amplifying Maternal Voices project at every stage, and really have helped to ensure that the voices of lived and living experience have really informed the toolkit as it's taken shape. So yeah, a massive thank you to the champions, but also everyone who's contributed to the Amplifying Maternal Voices toolkit in other ways. So I will share. You can see those okay. If not. So what we're going to be doing today, I'm going to take you through how we got to where we are with the Amplifying Maternal Voices toolkit, what's in the toolkit, and we also will hear from three wonderful people who've been involved in helping to shape the resource. And then finally, very excitingly, we will actually demonstrate on the website sort of how to use it and what it looks like. So just a very quick who we are. So we've been working obviously in partnership with Mental Health Foundation on this project. We're the Maternal Mental Health Alliance, and if you don't know us already, that means we're a UK-wide charity, a network of over 125 organisations, growing all the time, and dedicated to ensuring women and families affected by perinatal mental health problems have access to high quality, compassionate care. So I'm going to be talking a bit about the journey of the Amplifying Maternal Voices Toolkit over the past 2 years. And so where we started with it, what we were thinking, how we've built relationships within the project, how we drafted content, developed and tested it. So to the final product, and I think, and this really, hopefully ties in with other things that have been said so far, that really continuing to learn and improve what we're doing as well. It's not the end of the journey. So in terms of what our starting point was, we were very clear that whilst it's been fantastic that there has been significant progress within perinatal mental health, we know that unfortunately there are still huge inequities within that. We know that there are barriers to accessing care. There are seldom heard voices within this space, and we know that there are still gaps in services funding and resources. So with this in mind, we really gave a lot of thought to what the purpose of the toolkit should be and who the users would be as well. So in the end, we felt that it was really important for it to be a resource for individuals and groups across the UK who want to influence decision makers and create positive change in perinatal mental health care in their local area. So within that, we really hope it will inspire action at a local level, and as well as so important what we've been talking about today, really be a platform to amplify seldom heard voices within that. So I think within it, we found it's not about saying there's a formula for making this change, but really just kind of to offer ideas that might be useful. So as I've already mentioned, we would not have got here without everyone's fantastic support and ideas, and there really has been input at every stage of this development. So I've already mentioned that really we've taken time to build those relationships, to gain trust, and again that's come up in previous speakers, as I've said, with our lived experience champions, with our members, and also with our local contacts in Birmingham and Croydon, which is where we did some focus work. And that really was very intentional to take that time and to really build those relationships. And that came out very clearly. There's been a midpoint evaluation of the project, and that came out as a clear message that was something positive that was working well. So I'm delighted at this point to hand over to our first speaker within this section. So we're going to hear from Chrissy Brown, who is founder of the Motivational Mums Club and also one of our amazing lived experience champions. So Chrissy, I will hand over to you.
Hello, thank you so much. And I just want to thank everyone for being here. I always say that, in numbers, there are strengths, and we are all here because we want to contribute to that change. So not only can I just thank the Mental Health Foundation charity, but absolutely every single one of you, because already that is a change into that bigger picture. So my name is Chrissy Brown, founder of the Motivational Mums Club. Very conscious of time, so I'm going to keep it very high level. But my lived experience began after the birth of my second born. What makes me very unique is because I had a great birthing experience with my firstborn, and I had a very bad birthing experience with my secondborn, which led to really bad mental health for me. So what makes me unique is that I know what good looks like and I know what bad looks like. And for me, that is where I like to say the lioness was born in me, for the past lady that I was suffering with bad mental health, and for the women that are gone because they feel like they couldn't go on because of their mental health and the support that wasn't there. But most importantly, for the women that I currently support as well on the ground with my peer support group dedicated to Black mothers and birthing people. And my story began with me being very fortunate. I did come from a very fortunate background, graduating, working class parents, gave us everything that we needed. I'm one of 4 siblings, and I went through so many organizations, big brands like Goldman Sachs, the leading investment banking, one of the leading investment banks in the UK, the Financial Times, always been very career driven. And my last career was at Societe Generale, where I got pregnant with my firstborn, and I had this amazing birthing experience. And I was actually on cloud 9 when I was on maternity leave. My lived experience began when I was on maternity leave and I found out I was expecting my secondborn. And essentially I was having 2 under 2. And I just felt instantly that I'm losing my identity and I'm just going to be a mother. But deep inside, I didn't know how to articulate that I'm still Chrissy, and I don't want to be just a mother of 2 very young children. And that's where I couldn't really understand how to articulate myself, why these conversations not normalized, and who to go to. So after a very deep discussion with my boss at the time, I decided to go and see my GP, and that's where my mental health deteriorated further. because of it being such a tick box exercise and not being seen, heard or listened to, but most importantly, not being included in my care. I was just given one route, which was antidepressants. And I just remember that little spark in me just lit up for that split second that I felt like had disappeared. And I just challenged him in that moment in time. And I said, how do you not know that I need someone to talk to? And I was quite taken back by him giving me peer support groups. And that is where the Motivational Mums Club was reborn, essentially, if you know my story very well, where my organisation provides free mental health sessions to mothers and birthing people with 2 fully qualified psychologists. But I do have peer support groups on the ground for Black mothers and birthing people, because we are the least likely group to access mental health support due to the barriers and stigma and not trusting the system. There isn't any relationship there. And I really wanted to be that bridge for healthcare professionals to seek cultural intelligence, but then also a safe space for Black mothers to come and get support for their support and for their mental health. And it really touches very nicely on what Jennifer said previously, that, you know, we need the grassroots organizations to be funded. We need, you know, mothers to learn how to advocate for themselves. And that is the space that I've created called Mamas Together, where we give these mothers the tools to advocate for themselves, to normalize these conversations and let them know that they're not alone and it is okay not to essentially be okay. So that's the work that I do very closely with the Maternal Mental Health Alliance, along with many other organizations as well. So yes, that's me in a nutshell. And I do apologize. I am currently at the Children's Centre next door and my group is being run. So for me, it's just important that, you know, the work here continues. And this is why I made it my mission to make sure I speak here, because next door magic is happening, where we do have midwives there actually supporting the mothers, and they feel safe enough for me to be here in this conference to educate everyone here while something next door is really happening and essentially saving lives. And I just really want to make sure that is spotlighted in all of this as well.
Thank you so much, Chrissy. Yeah, as you said, you're juggling so much, and that's just incredibly powerful. And really appreciate you sharing your story. And as you said, the magic, you know, is still happening next door. So thank you. That's exactly why this, you know, what we want to spotlight within this project. So just following on from that, I thought it'd be worth sharing some of the key themes that came out of those kind of early conversations that we were having on the ground. Again, I'm sure this will be familiar and resonates kind of with what we've already spoken about. The first one, just how crucial it is to listen and build trust in this area of work. And I think we got a sense that there's often sort of a lot of talk and very little action, and the frustration that comes from that. So really having to prove through actions that trust is there. And again, I think it came up earlier about building meaningful partnerships, so really bridging that gap between grassroots and a sort of NHS service level as well. I think also another thing was about really the importance of being very intentional in this type of work. So this kind of changes, and it's not accidental, it's by people fighting for it and really keeping that focus there. Again, relates back to the earlier in this session, that really having that flexible person-centered approach, really getting to know a whole individual and all the facets that they have with them is really, really important. Again, just the complexity that's out there. So in terms of the landscape at the moment, and high demand coupled with under-resourcing. So we've already heard about funding, and we know that that's an issue for lots of groups, and at a time when things are very complex. But on a more hopeful note, I think one of the things that really struck me when we were visiting people and speaking to people is just how small things can make a big difference. So the impact of the work that people are doing, and sometimes it can be such a small thing, just asking how someone is, making them a hot drink, you know, it really can change, you know, the course of someone's day. So building a bit on what we've heard. We've just got a small selection of quotes, both from lived experience perspectives, but also from some of those groups and organisations who are supporting people with perinatal mental health issues and trying to overcome some of the barriers that we've talked about. So here from Sapna, who we saw in the video, one of our champions, saying it's hard to get our voices heard when we're overwhelmed and no one is there pushing us up. And then from Donna, who's from Acacia Family Support in Birmingham, talking about their work with young parents. So saying that we go to where young parents are and try and communicate in a way which works for them. We keep trying, even if we don't hear back the first few times. And then just two more. So from Natalie Nuttall at Hearts and Minds Partnership, we hear from the voluntary community and social enterprise community how hard it is to navigate the commissioning landscape when we're meeting massive demand and operating within small teams. It's so important we're at decision-making tables when an integrated health system is clearly the way forward. And a final one from another one of our champions, Maria, talking about kind of the importance of story sharing to make this change. So I share my story to raise awareness of maternal mental illness and reduce stigma by openly talking about my experience. So I'm very pleased to welcome our next speaker. So I'll hand over to Madeline Lenchner, who is Maternity Core Connector at NHS South West London.
Hiya, thank you so much. Hopefully you can hear me all right. I am in a community space, so there's a room of children singing next to me, so apologies if you can overhear anything. But yeah, so I'm what's called a Maternity Core Connector with Southwest London ICS. So this was created from the Core 20+5 framework to engage marginalized communities to address maternal health inequalities through co-production with a variety of stakeholders. So partnership is really at the center of this role and the work that I do. And this is done through bringing together different services from both service users and local organizations and the NHS for different purposes. So from this work, we've created a maternity coffee morning, which is an open space for parents to discuss their experiences, to meet other people, and we really encourage peer support. So we not only have the coffee mornings, but we have a WhatsApp as well for continued engagement. Each session is themed. So we've previously had perinatal mental health sessions, sessions on pelvic health, sessions on infant feeding, and we hope to do several more in the future. So they're held once a month. So we have several different Croydon partners included. So it's held at Baby Zone, which is a wonderful resource in Croydon. We've engaged with the SLAM teams, the Helix team, as well as the Croydon BME Forum, the local Croydon Trust, and the Maternity and Neonatal Voices Partnership. So we use this space to highlight the priorities of the parents and birthing people themselves, as well as the priorities for the local VCSEs we're working with. And we're trying to pair up the different priorities to make sure that everybody is heard. And so during these sessions, we like to have at least one or two different professionals in the room, but we do encourage a no name tag or name badge policy if possible. And we really encourage the different professionals to participate in conversation as well, to sort of break down the barriers between service users and professionals in a way to have really meaningful conversation. So looking forward, we're hoping to create a similar service user group in Wandsworth in partnership with Croydon as well, that will specifically focus on perinatal mental health of LGBTQ+ service users. And so we have a few different partnerships already building and in the works. And additionally, we will be holding what's called the Whose Shoes engagement workshops in all 4 trusts of Southwest London. So this brings together different stakeholders from all areas of maternity to directly address equity within maternity services, and to bring both decision makers, people of financial power, if you will, service users, NHS staff, all into a same table and having open discussions together. So thank you.
Thank you so much, Madeline. And yeah, we've worked together in Croydon, and yeah, it was just fantastic to hear about those kind of meaningful partnerships being built and that collaboration, which is exactly what we want to encourage. So thank you so much for sharing. So back to the toolkit itself. So after we'd had the initial conversations, we really then kind of wanted to take that out for testing. So we had workshops, we had individual conversations, and we presented what we'd already got, and then really again tried to take on board the feedback that was given to us, what was working well, what needed improving, to then kind of get to the final draft. And we just wanted to share as well, we've already said it's really taken a lot, and lots of different people to get to today's toolkit launch, and again really grateful for everyone's involvement. So just kind of wanted to give a sense of that in some numbers. So in total, we held 8 workshops across the project for the toolkit with 80 participants. We think we did around 350 hours of community engagement, and we had well over 100 individual conversations as well. So really delighted now. We heard from Amanda briefly earlier, but really happy to introduce Amanda, who is founder and CEO of Maternity Engagement Action based in Birmingham. And we work together on the toolkit as well. So Amanda, I'm very happy to hand over to you.
Okay, sorry everyone, I've got a bit of a frog in my throat today. So please do excuse me if I start the coughing, and I'm fasting so I can't drink any water. So thank you everyone, thank you Sian and the team for really creating this resource and bringing us all together today. And also thank you for inviting me to speak today. So my name is Amanda, and as Sian has said, I am the founder of Maternity Engagement Action, and we are based in Birmingham. We support Black and Black mixed heritage perinatal women across Birmingham and the wider West Midlands. And we do this because of the unique intersectional discrimination that we experience throughout our life, but especially during the perinatal period when we're at our most vulnerable. Our work covers engagement. So we have some groups. We have a private Facebook group called Melanin Mums of Brum, and we also have a milk and chocolate infant feeding group on WhatsApp. We provide connection. So we have Melanin Mums Connect, and we come together and we have different activities. For the past couple of years, we've experimented with lots of different things like swimming and all kinds of different things, but the most successful one we had was what we called Saturday Soup and Birth Stories, which is a traditional sort of Caribbean, and speaking to my African community, my sisters in the African community, yeah, soup is a great thing that the family and the community bring together and encourage, love and learning and support and nourishment. So that's our most successful. We also do some work around leadership, and we have a group called, it's a program called Maternity Ambassadors for Change, and it's come together to look at the other part of the work we do, which is around local research. And I hear you, Jennifer, when you were talking about we don't need any more research, we really don't, but what we do need to do is find out from local women what's going on the ground in the grassroots. So we hope that by having these conversations and hearing these stories, we can bring that to the system to kind of get some systems change or hold the systems to account, because there's so many initiatives, so much research has been done. What is that having an effect in the grassroots at the front line with women in the community? So that's what we mean by local community research. And we developed a campaign last year called See Me, Hear Me. And that was about showing Birmingham, the system in Birmingham, that when we engage with women, we do it from our own unique Black lens. We don't do it from a white gaze. We do it from, lived and living experiences. We do it from tradition, because we feel that a lot of our traditions have been lost. And we need to kind of draw back on those things that, the grandmas and the aunties from back in the day, how they used to look after us and care for us. And they also did a couple of things that were not great either, stand on your own 2 feet, get up, be strong. So we take what's good from that and we leave alone what wasn't so great. And we're also working with a PCREF, which is the Patient Carer Race Equality Framework. And we see these things as what we call real co-production in our community. So for us, it's about trust and pace. And it's not about the system's time frame, but our time frame, because what keeps happening is, the system wants to rush us to provide, the information that they need and the results that they need, but the system are really, really slow. you know, so it's not about them, it's about the impact from our Black perinatal lens. And I just wanted to say that this resource that the team have put together, I think is going to be really, really extraordinary for us, because I was reading through it today and I saw that, you know, this was co-production in its real sense, because I seen that Sean and the team kept things in for real. We said things, and I said things, but I can imagine all of us said things, and it's in there. And that's really important, because that means we've been seeing our voices are not being erased, and that's what we're mirroring and replicating when we're in our communities. And I just wanted to say that, you know, the work with Maternal Mental Health Alliance and the Mental Health Foundation, it's a game changer, because we're out here fighting, we're standing in the gaps and we're fighting the system. We're fighting to understand all of these elements in a really changing landscape. And they've put a resource together that's for us. It's for local women as well, but it's for us as well. And that kind of helps us with, you know, navigating the landscape ourselves, but also I think it kind of helps with our own mental health and well-being. I talk about that a lot, that we, you know, this work that we do is heartbreaking and it's exhausting and it takes a toll on us physically. And if we can find making connections with other people, breaking barriers, collaborating and have it at our fingertips, it's only going to help us to continue doing what we're doing and continue fighting, because a lot of organizations end up dying and going by the wayside, and they're doing fantastic work, but because the resources aren't there, whether that's financial or people or support systems, we're kind of like, we're dying out. So it's amazing. I'm looking forward to using this I've lost my word. I'm looking forward to using this resource and this toolkit. I think that it's going to be great, because it's going to help us. It's all those, you know, toolkits and things that we can use, help us to showcase to the system that the work that we do is transformational. It's mindful, it's trauma informed, it's compassionate, it's not extractive, and it's not cold, and it's not a transaction. And it's going to just be awesome for us to work together, collaborate with each other, and really help ourselves and our teams to, like, you know, keep strong and keep going forward. So thank you for giving me the time to speak, and thank you to the team for putting this together.
Well, thank you, Amanda, and I honestly can't tell you how much that means to me to hear that, because yeah, we've worked really hard, you know, and you were one of the first people I spoke to in Birmingham, and I did really hear what you said, and I think that's what we're trying to build on, is to say, you know, let's put that in there, and so on. We want it to be useful, so I really, really hope it is. So thank you so much for sharing that and doing the incredible work that you're doing, and yeah, really, really appreciate your time today. Thank you. So on that note, in terms of, I guess, yeah, Amanda's hinted already at some of the things in the toolkit if you haven't seen it already. We have broken it down into 4 sections. We have breaking barriers, making connections, sharing stories, and demonstrating impact. And then within each section, what we've tried to do is you'll have examples, and we've really tried hard to kind of make it as accessible as possible, have different learning methods in there, so you can read, watch and listen different examples. And then we have the practical tools, which are around tips and templates and useful links. And so just to give you an idea of what that looks like kind of on the website as a user journey, but we'll look at that in more detail in a minute. But just, you know, you click on one of the different sections, and then within that you have a bit of a summary, so background information, and again really trying to capture what we've heard when we've been out talking to people. And again, those examples to read, watch and listen, and the resources on the more practical side. And again, you know, I think really hoping that some of this will bridge that gap, that people can use it to make some of those connections locally, whether you're coming from a grassroots perspective or whether you're, you know, someone who's a health professional, for example. And there is also, again, we'll look at this in a minute, but there's a workbook, which is a simplified version of the toolkit, that's also, they have the option of downloading so that it can be used offline as well in different ways. But at this point, I will stop sharing my screen in a second, because we're very excited to actually share the toolkit itself now. And we really hope you can let others know about the resource. And I'm going to hand over to Amy, who is our comms lead at the Maternal Mental Health Alliance, to talk you through the website. Thank you, Amy.
Hi, everyone. Just wanted to say thank you for everyone who's spoken so far. My brain is absolutely full, and I'm very grateful to you all. Now, before I share the toolkit with you, I just want to say that, you know, they tell you never to work with children or animals, but I would like to add tech to that list, if I may. Now, I know most of you work with children. I've got a feisty Jack Russell running around, and I'm about to demo a live website. So I think all of your well wishes and good luck would be very much appreciated. So off I go. Here we go. So I thought it would be helpful to start with how you can find the toolkit itself. So as well as the short link that you will see all over our social media, which is maternalmentalhealthalliance.org/AMV-toolkit. You can also get there from the homepage if you use our slider right as you come onto the Maternal Mental Health Alliance website. This will take you directly into the toolkit. You can also get there through Creating Change, Projects, Amplifying Maternal Voices. But I'm just going to dive straight in. So it has been my great pleasure to bring to life all of the work that Sian has done with many, many people here today, with our champions, with our members. Yeah, there was a lot to work with and bring together into something hopefully really useful for everybody. So on the landing page of the toolkit itself, as Sian mentioned, she put together a user guide. We've got this in both video format, and we've also created a text version of this as well, again, trying to be as accessible as possible and cater to as many people's needs as possible. But please do get in touch if there's anything that you think could be improved in future. You can get to the text version here, read the user guide. And just to reiterate what Sian said, we've kind of got the 4 key themes of the toolkit here for you, which you can dig into each one as and when you have time and space, because we know that people are time poor and working really hard here. So we've tried to keep it as kind of bite-sized and interactive as possible for you to kind of dip in and out and look at kind of what will best support you in your work. I'll come back to one of the toolkit sections in a second, and we'll look at it together in a bit more detail. Here is the lovely workbook that Sian mentioned. So you can work on this online, or you can download it, print it, work on it offline as well. It's really a summarized version of everything that now exists on the website in kind of digital toolkit form. We've got a bit of a glossary as well, because there are terms here that we know it might be the first time that people are seeing it. So we want to make it, again, as easy to understand and digest as possible. We've got some notes about the toolkit as well. And really importantly, we wanted to make sure that every single organisation who supported the development of the toolkit was mentioned here, and you can find out more information about them as well. And just a shout out to Mental Health Foundation at the end here, because without them, this just wouldn't have been possible. So thank you to Mental Health Foundation. I'm going to take us now into Breaking Barriers, which is the only section in the toolkit which was so enormous. There was such a wealth of information that we had to split it into 2. So breaking barriers in terms of access to perinatal mental health care, and breaking barriers to get more people involved locally. But we are going to look at accessing perinatal mental health care. Oh, sorry, see, I told you it was going too smoothly so far, so bear with me while I scroll all the way back up to the top. Ignore any spoilers. So yeah, this is Breaking Barriers, Access to Services. Within every section of the toolkit, you will find a summary about what this section is all about, who it's for, what we aim to do. We look a little bit about the landscape in which we are operating, and what the reality is for families and people working with families on the ground is actually like. And again, it's a bit of a theme. We had so much that came out of the workshops and the meetings with individuals and organisations. And there are so many barriers, many of which have been mentioned today. So within Breaking Barriers, you can access kind of information about these in a lot more detail. But what I really want to show you is kind of how we've tried to cater to everyone's learning style. So we know that different people like to read examples of best practice, they want to watch videos, they want to listen to podcasts. We wanted to make this resource as rich and full as possible and to cater to as many people as we could. So again, within every section, you will find examples of organisations who are breaking barriers in their local areas or making connections, or how they're sharing stories to influence change and make people feel less alone. But here we have a plethora of organisations doing amazing work and talking about their amazing work. And anywhere where we're talking about these things, you can go off-site, learn more about them directly, get in touch, hopefully build those connections. We have quotes, as Amanda mentioned, from the workshops to kind of really bring to life all of the work that's gone into building this toolkit out and making this a really, hopefully, helpful resource for everybody. It's nice and interactive. So these are slides from the brilliant Jennifer from earlier, from the conference last year. We have links through to stories of where kind of we've got it right in terms of care, and also what happens when that care isn't available. So yeah, examples to listen, and a huge number of videos in this section as well, just really demonstrating kind of what we can do to improve perinatal mental health care for families. And then moving down to resources, this is really the practical section. So taking all of that learning that we've just gone through, all of those examples of best practice, and giving you kind of practical tools and tips to take away and how to kind of spark change and inspire better care in your local areas. So again, within each section, you have these nice nested tips, some useful links to organisations, and also some practical templates and worksheets that you can use. Now, these are all interactive as well, so you can fill out your worksheet, answer the questions within there before you print it off, or you can print it off directly and fill it out by hand, whatever works for you. And finally, because the toolkit is so massive, and I promise Shan I will be quiet soon, I'm nearly done. But yeah, we wanted to make sure that wherever you are in the toolkit, you never get lost. So you can scroll down to the bottom and kind of delve into and explore the additional sections within the toolkit, or you can head straight back to the landing page. And I think that is me.
Thank you, Amy. Well, I hope, I mean, we, you know, obviously we hope people go away and explore, but I hope that gives you a sort of a flavour of where we're up to. So I will just reshare my slides. And I think the technology went pretty well there, Amy. Well done. So yes, so there we go. We have shared the toolkit. Please do go and check it out for yourselves. And finally, sort of just a last few points from me, really. As I said, you know, this is a new resource. We want to continue to learn from it. So it's something you know, we would love to sort of add and adapt. So I think it's once people start using it, we'll kind of get the feedback of how that's going. And so we really, really hope we have tried very hard to make it as practical and easy to use as possible. So I hope we've done okay with that. But yeah, please do let us know what you think. And I guess in terms of next steps for us, obviously we'll be, our external evaluators will be looking at the project as a whole, and we'll learn from that. And we're really giving some thought as well to the legacy of all of this. We don't want those lessons to be lost. So, you know, really how that feeds into all of our wider work as well. So I think for me, all it remains to say is a massive thank you for listening. Thank you in advance for hopefully exploring the toolkit. We'd love you to share the toolkit. Obviously, you've got the links there. My email address is there, so please do get in touch if you have questions. But yeah, we really, really hope it's useful. And again, and not just to end on a huge thank you, as we keep saying, this resource wouldn't exist if it hadn't been for all of the amazing contributions. Thank you obviously to Mental Health Foundation as our funder and partner. But yeah, if we hope, you know, we've really tried to take on board what we've heard. So we just, yeah, thank you to everyone who's been involved. I will stop there.
Thank you so much, Sean. I think it looks amazing. I will be biased as part of the project, but we do encourage any kind of questions or comments in the chat for Sean and Amy and the Maternal Mental Health Alliance team. I echo Sean's comments in terms of, it's launched today, it's live. We really, really advise you to kind of look at it, download it, read through it, share it with your partners, your networks, grassroots organizations. This is really kind of like our legacy for the Amplifying Maternal Voices Project, and it shows real evidence of what we've really tried to do to amplify women's voices and that we don't usually hear from. So thank you so much. If there are no pressing questions so far, I think we are keeping an eye on the chat and the Q&A. We have come to an end, and we've got a lot of time, and I would just like to reflect and take this time to appreciate everyone here who has supported the Amplifying Maternal Voices project. As I advised, this project started in October 2021, and through to this year, April 2024, we don't want to just be a 2-year project that just pops up and, it's kind of done, and all these amazing grassroots organizations that we aim to spotlight kind of fall and are not given the right recommendations and support for the work that they're doing. So we really, really want to use this toolkit as a legacy of our project to ensure that it does do what it does. It does spotlight these groups. Here at Mental Health Foundation, we are an evidence-based organisation, and we do, from what we've seen today, we can see that, research and grassroots organisations, this is all a holistic approach to supporting women. We heard earlier from patients and Professor Colin about the importance of PCPs and how we can take it and use it and really support women with suffering from severe mental health issues. I would like to just really reflect and think how far we've come and how much more we need to do, and how we can really, really continue to support grassroots organisations and women and families that need it. So thank you again for coming. Thank you for attending. We will be following up with the survey and the recording alongside the resource and the links to the toolkit. Please do share, comment, tweet about what you've learned today and use it in your working capacity of how you support women.